Senator Kennedy died overnight after a battle with brain cancer that lasted more than a year, about 15 months. We learned the word glioma in covering this story. NECN's LATOYIA Edwards joins us with more. LATOYIA?
RD, Senator Kennedy's type of cancer is rare when comparing it to all forms of the illness. It accounts for just 2% of all cancer-related deaths. Today we spoke with a neurosurgeon and oncologist to give us some perspective.
When Dr. Francis Rockett fields questions about Senator Edward Kennedy's brain cancer, this model of a brain comes in handy.
If the tumor infiltrates into the brainstem, then a lot of these functions are affected. And if the pressure continues, then the person stops breathing or their heart stops.
The neurosurgeon who did not treat Senator Kennedy uses the model to explain to concerned patients that Kennedy's tumor was located in the parietal lobe of the brain.
The parietal lobe here is a sensory part of the brain.
On May 17, 2008, Kennedy suffered a seizure at his Hyannisport, Massachusetts home. 3 days later, he was diagnosed with a malignant glioma.
A glioma means a tumor of the brain, just like people can get cancer starting in the breast or cancer starting in the lung. You can get a cancer that starts in the brain.
The American Cancer Society estimates 22,000 malignant tumors of the brain or spinal cord are diagnosed each year, and annually approximately 13,000 patients die from this type of tumor.
Being diagnosed with a malignant glioma is heartbreaking for anyone, but the age of a patient usually dictates how long a person will survive.
This is a type of cancer that is fairly common in younger people, unfortunately, in their 30s and 40s. But the older the person is, generally the worse they tend to do.
Dr. Claire Fung was not part of Senator Kennedy's treatment team, but serves as a radiation oncologist. In a Newsweek article, Senator Kennedy wrote he received the latest radiation treatment called protobeam therapy at Mass General Hospital. He said he endured many rounds of groundbreaking chemotherapy following surgery to remove as much cancer as possible. Dr. Rockett has performed this type of brain surgery many times.
For example, if it's near the speech area, you don't want to remove that and have a person totally unable to communicate.
Cancer specialists are encouraging patients with mild to high-grade malignant gliomas to seek a multifaceted treatment like that of Senator Kennedy. His initial prognosis was that he had just a few months to live. He lived for 15 months.
We're seeing probably about a quarter of people survive at the 2-year mark from the time of diagnosis. Whereas 10 years ago, we unfortunately didn't even have statistics like that.
RD, the oncologist and neurosurgeon that we spoke with, said every year scientists find more effective ways to treat malignant gliomas. The newest involves molecular research to learn which radiation treatment works and which doesn't. And because of these advances, the doctors tell me there is reason for patients to always have hope, RD.
Our medical reporter, LATOYIA Edwards. Thank you, LATOYIA.